My name is Amran Dhillon. I'm one of the new GP registrars. I've come recently from Echuca and I spent a few years at the Northern Hospital in Epping, where I did majority of my resident training. I'm on the pathway to become a rural doctor, and I chose Ballan as one of my towns to complete my training because it offers me a whole range of not just primary care within the clinic, but there's also a hospital in which you're attached to. And I think as a GP registrar working in the country, that's one of the unique things about it is you don't only just have a role to work in the clinic, but you've also got a duty of care to attend to patients in the hospital. Another unique thing about Ballan is we have a small urgent care, so we can have any sort of range of emergencies attending, and we have to attend to that first year before we can transport them to a more bigger hospital. And coming from a background in emergency medicine is very helpful in that regard as well. So far I've been here for 3 months now and I've enjoyed the town. Met a lot of great people and really friendly patients, and I look forward to spending the rest of my year here. The community is small, people are very thankful for the care you deliver, and you not just only have to know about one thing, but you really have to cover the whole lifespan from newborns to the elderly. You need to service the nursing homes, you need to offer palliative care, you might need to offer your emergency services. So you deal with a whole range of things, and I think that's probably one of the more attractive features about country medicine, and that's what drew me to it and made me step away from the big smoke and get out of that big hospital building and venture towards a career that was a little bit more flexible but also more versatile in terms of the skill set that I bring and the skill set that I can actually use as well. My main areas which I like to focus on, or my special interests rather, are pediatrics, emergency medicine I've already touched on. So anesthetics is something I do, so that branches into pain medicine and more of the cardiac and respiratory stuff. So I like the heart and the lung, and I do like the nursing homes as well. I really enjoy working with the elderly, so aged care and just general medicine is another interest of mine, and that's where having a little hospital attached to the clinic is useful because I can use those general medicine skills that I've learnt from my acute hospital working in Melbourne and bring those skills down here. Yeah, so outside of work time, I think that's the other advantage of being a GP registrar, or soon to be a fully fellow GP, is you've got that flexibility to participate in all your other interests. I love to play tennis. I'll usually go for an evening run around town. I like to keep fit. I also have some interest in music and dancing. I've used to play basketball a little while ago, catch up with friends when I can. Love traveling. I've been to a few places in the world. I love to travel more. I also like attending conferences because it's not just a holiday, but you get to learn a lot of stuff and meet different colleagues. Yeah, so a lot of interest outside of medicine, really, really important to have so you can keep focused at work.